Hi, good morning, Darren. My name is Mihiraa. I'm your invigilator for the OIT speaking session on the 14th of November 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Darren Kurzvoigt.
All right, Darren. Could you please confirm your candidate number?
Yes. My candidate number is 431331231.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
What do you find the best part of being a nurse?
The most rewarding aspect of being a nurse is the direct impact on people's lives. Helping those in pain or facing challenges is immensely fulfilling. Being a support for patients and their families creates a unique sense of satisfaction. Personally, I find joy in doing what I love, and being compensated for it, making it an invaluable experience.
How well can you cope with the advances in medicine?
Over the years, the medical field has evolved significantly. I am adept at navigating the latest technologies and systems, ensuring efficient information management. Familiarity with advanced databases, applications, and analytical software allows me to adapt to the dynamic nature of the medical sector, facilitating faster and more accurate data processing.
What are some of the most important things to consider in the nursing position?
In essence, not every challenge in nursing has a pharmaceutical solution. It's crucial to delve into each patient's unique situation, offering personalized care. Words and empathy often prove as impactful, if not more so, than medications. This aspect adds complexity to the nursing role, emphasizing the importance of treating patients holistically.
How would you work with the charge nurse?
Recognizing the pivotal role of the charge nurse, I would seek to align my efforts with their coordination and planning. Understanding their preferences for care coordination and familiarizing myself with patient care requests would be a priority. Respecting and valuing the decisions made by the charge nurse, I believe in collaborative efforts to ensure the smooth functioning of the entire department.
How do you handle unexpected circumstances like short staffing, unfamiliar treatments, etc.?
Confronting unexpected challenges, I take a methodical approach. Assessing the situation, I prioritize tasks and adjust my plan accordingly. In instances of short staffing, I focus on essential responsibilities. When faced with unfamiliar treatments, I consult available resources, such as nursing policies and manuals, and seek assistance. Embracing challenges, my commitment to continuous learning remains unwavering.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning, Mihiraa. I am Nurse Darren, your attending nurse. How are you feeling today?
Good morning, Darren. I'm good, thank you. How about you?
I'm doing well, thanks. Mihiraa, I'm here to take your vital signs before your discharge. Do you have any questions or concerns?
Why is it necessary to take my vitals again, since I'm getting discharged today?
I understand your question, Mihiraa. Taking your vital signs is a standard part of our hospital procedure, especially as we approach your discharge. Monitoring your blood pressure, temperature, and oxygen levels ensures you're in the best possible condition for a smooth transition home. It's a crucial step in maintaining your overall well-being. Additionally, we're genuinely interested in understanding how you feel about going home.
Is it too early for me to be discharged? I'm concerned about my care and support after discharge.
Your thoughts are natural. Mihiraa, I'd like to know the support you have from your family or friends on a regular basis until you regain your independence.
I have my granddaughter with me and a good neighbor. But when they leave for college and work, I'll be alone.
I understand. And may I know your concerns about going home?
I'm afraid of walking around independently, especially of falling in the shower. Secondly, when and how will I receive my medications, especially for pain relief? Nurse, I'm also worried about caring for the wound. No, nurse, I'm not prepared to be discharged.
I acknowledge your concerns. As you prepare for your upcoming discharge, I want to take a moment to reassure you and your family about the support and education that will be provided to ensure a smooth transition into the next phase of your recovery. Our dedicated healthcare team is committed to your well-being, and we understand the importance of equipping you and your loved ones with the knowledge and skills needed for a successful recovery at home. Before you leave, our physiotherapist will work with you to provide guidance on mobility, ensuring that you feel confident and comfortable with any exercises or movements necessary for your continued healing.
Oh, I see.
Yes, Mihiraa. Also, our pharmacist will take the time to thoroughly explain your medications, including proper dosage, potential side effects, and any other relevant information. Understanding your medications is crucial, and our pharmacist is here to answer any questions you or your family may have.
Okay, that's fine.
In addition, our skilled nurses will provide detailed instructions on wound care and management. They will guide you through the steps to maintain optimal healing, addressing any concerns you might have, and offering practical tips to make the process as seamless as possible. Mihiraa, I hope your concerns have melted away. Haven't they?
Yes. Good to hear that, nurse.
Is there anything else I need to address for you?
Thank you for your consideration. Regarding follow-up care, when is it appropriate to make an appointment?
I appreciate your thoughtfulness. Mihiraa, I'll guide you on when to call the hospital in case of major concerns. Firstly, the appointment is crucial to assess and address any concerns related to your wound. Our primary goal is to check the healing progress, reinforce the dressing if needed, and discuss any worries or questions you might have. Your comfort and understanding are vital during this process, and your GP is here to provide the support you need. Apart from that, if you experience any major concerns, such as excessive pain, despite medication, unexpected bleeding from the wound site, or an elevated temperature, it's important to reach out to the hospital promptly. Remember, seeking medical attention is a proactive step towards maintaining your health and promoting a smooth recovery. Your well-being is our top priority, and we want to address any issues as soon as possible to ensure a smooth recovery.
Yes, nurse, I understand the importance. I will follow your valuable suggestions.
That's perfect, Mihiraa. Well, before the clinical examination begins, your consent is a crucial part of the process. Do you consent to go ahead with clinical observations?
Yes, I consent.
Thank you for your consent, Mihiraa. If you have any further questions, or need assistance scheduling an appointment, please feel free to contact us. Your health matters, and we are committed to providing the care you deserve.
Thank you for clarifying everything, nurse. I appreciate it.
You're welcome, Mihiraa. I wish you a speedy recovery.
Thank you, nurse. That concludes our out-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.